I am in a high-risk age group.
High risk, but highly motivated. 67-year-old Dr. Ann Saxberg retired last year. No longer can she watch as the COVID-19 coronavirus kills and changes the way we live.
I feel I have a moral obligation to share my skills.
For 28 years, she was an infectious disease and palliative care physician at Huntington Hospital on New York's Long Island. It's one of nearly 24 hospitals run by Northwell Health, New York State's largest private healthcare provider. She is exactly the sort of healthcare professional hospitals everywhere need right now.
Why, may I ask, do you get emotional talking about this?
I think it is because I feel it is a moral obligation. And I feel I have this in common with other healthcare workers. They're putting themselves on the line every day and going to work. This is kind of who we are and what we're made for. And it's hard to sit on the sidelines.
She is also one of thousands of Americans heeding the call, helping take on the biggest challenge the U.S. and the world has seen in generations.
We can't imagine what it's going to be like a week or two from now. I think it's going to be a bad situation, and we are going to lose a lot of people.
Hospitals know what's coming. Not only are they critically short of protective masks, gloves, gowns, beds, and ventilators, they also expect doctors, nurses, and first responders to get sick and face quarantine themselves.
So we're asking former doctors and nurses, contact your previous employer. Department of Health will accelerate your recertification.
Northwell Health, where Dr. Saxberg worked for her entire career, has 72,000 employees helping run 23 hospitals and nearly 800 outpatient clinics throughout New York. 75 employees have tested positive for the virus, mostly from community exposure, but a larger number, 270, have been forced to stay home and self-quarantine due to exposure.
I've got everything I need right here.
For now, Dr. Saxberg is devouring every scrap of information about the disease she can, waiting for the inevitable call to return to work and get back in the game, whose rules are still not fully understood.
I don't think we have any idea of how many people are going to end up requiring hospitalization in a very compacted period of time.
If and when a wave of critically ill patients need care, Dr. Saxberg fully expects to be on the front line. Miguel Marquez, CNN, Huntington, New York.
All right, Miguel, thank you very much. This just in, the spokesman for